Hello, I'm Dr. Chin. Today, we will focus on trachea. We will go over on how to scan and position. To scan trachea. First, we can place the probe at the suprasternal notch. Place it horizontally. You can observe the trachea, as well as its hyperechoic surface. If you wish to see the cricothyroid membrane, we can then place the probe in sagittal view at the cricoid cartilage and thyroid cartilage to locate the cricothyroid membrane. Let's prepare to start the scan. In this part, place the probe horizontally. This would be easier to locate the trachea. In the middle, there is a high brightness shadow, which is the trachea. You can move it up and down to scan the trachea. After scanning in the transverse view, let's adjust the probe to sagittal view. Continue to scan up and down along the trachea, observing every little detail. Now let's move on to the cartilage. It's important to be able to differentiate cartilage. We can see the cricothyroid membrane when the patient needs to perform surgical airway. This is an important landmark we need to first locate. You may capture or record on your mobile devices. That's all for today's tutorial. Looking forward to the next video.